So I'm sorry for the cut guys now, pero let's proceed with our next route of administration. So we have our intra-arterial na route of administration, and this is defined as the injection directly into an artery. So halata na siya sa name niya, no? Then ang advantage dito is it delivers drug to specific organs or tissues. Then another is intra-arterial na route of administration is very useful in chemotherapy and or imaging. Pero ang disadvantage ane kay challenging siya and risky. So kailangan pod o professional na skill din and there is a potential for arterial damage. Then in terms of its plasma concentration curve, there is a rapid rather and targeted peak concentration in the affected tissue. The next is our intracardiac na route of administration, and this is the injection into the heart muscle or chamber. Then ang advantage nito, there is an immediate drug action during cardiac emergency. So for example, in cases of cardiac arrest, pwede ta maghatag og intracardiac injection to counter that one. Then ang disadvantage lang nito, this is highly invasive and it requires precision and skill as well. And usually kaning intracardiac ginagamit siya sa sa animal studies. Kay sa animal studies manggo, 'di ba, ang mga animals nato dira commonly kay atong mice. Then 'di ba gamay kay ilang vein. So instead of intravenous ang pag-inject sa substance na gusto nato i-study, pwede siya ihatag intracardiac sa atong mga animals kay mas dali man makita ang heart nila. Then in terms of plasma concentration curve naman guys, there is an instant spike in concentration. And ana ang main idea sa plasma concentration curve sa atong intracardiac route of administration. Then next is our oral. Then basahon na lang nato nino. The oral route of administration is the first choice for the administration of drugs since it is both convenient and economical. So our oral route of administration or our oral drug, 'di ba, dili na jud kailangan ang assistance sa atong mga healthcare professional. Pwede na ang patient mismo ang mag-inom sa tambal, then hatagan lang sila instruction on how to take those oral medicines. Then another thing is that most pharmaceutical active ingredients exert their therapeutic effect outside the gastrointestinal tract. So ang gina-point out lang ani nga bulat guys kay si oral na route of administration or oral drugs nato, usually ang iyahang effect kay systemic, not local. Pero natay exemptions diri kay sa, for example, yung mga drugs natin for gastrointestinal tract, for example yung antacid natin, although ginatake siya orally, hindi systemic yung effect ng antacids natin. Ang effect niya is local kasi ang site of action niya is yung mismong stomach natin or yung GI tract natin. So that is an exemption of the assumption na basta oral, systemic effect. Then another thing is that our oral na route of administration, they must be absorbed from the GI system, or our oral drug must be absorbed from the GI system to gain access to the systemic circulation and reach their site of action. So kanigi balik-balik na nato. Then katunggi example nako mao na nang naa sa last bullet, pero ang example diri kay si bismuth subsalicylate, which is an antacid. So specific example sa antacid ni, so kani daw siya si bismuth subsalicylate, for heartburn pwede ay siya, pero pwede din siya na antacid guys. So pero kana idea is yung mga GI drugs natin, although ginatake sila orally, yung effect nila is local kasi yung site of action nila sa GI lang din. Then another example is ezetimibe, which is used for the reduction of cholesterol absorption. So this is an example of an oral drug na ang effect is local. Then, take note lang of the factors that affects oral absorption. We have our diet, hormones, the autonomic nervous system, pathological states, other drugs, physicochemical properties of the drug, and losses due to pre-systemic metabolism. And we will discuss this sa later topics na natin about absorption. Then, our next na route of administration are buccal and sublingual. So when we say buccal route of administration, guys, the drug is placed between the cheek and gum for absorption through oral mucosa. So sa may cheek ginabutang ang drug na to basta buccal route of administration. Meanwhile, basta sublingual naman, the drug is placed under the tongue for direct absorption. So basta sublingual, again under the tongue. Then basta buccal, naa sa may cheeks. Then kaning buccal and sublingual na routes of administration, they have rapid onset of action, which is due to the high blood flow and lymphatic flow of the oral cavity. So highly perfused daw, guys, ang atong oral cavity. That is why paspas lang po ang absorption dira. Then in buccal and sublingual effect, there is no loss due to first pass effect, as the buccal venous drainage flows directly into the superior vena cava. Pero kana ay main idea basta buccal and sublingual, they bypasses first pass metabolism. Then ito mga specific na advantages ng buccal and sublingual, read through this na lang. So they have a rapid onset of action. Then this is not only by the high blood supply of the area, but also by the lack of GI factors that delay absorption, such as the gastric emptying, presence of food, gastric disease, etc. Another is, through these routes of administration, the portal circulation is avoided, which allows to improve the bioavailability of a drug, avoiding intestinal and first pass hepatic metabolism. Then, another is the active ingredient is not exposed to the aggressive GI medium, reason why it is possible that, this is a reason why buccal administration of some drugs, this is one of the reason why yung drugs natin, tiniturn sila into a buccal na formulation so that dili sila ma-degrade sa GI, pH, and enzyme. Or hindi. Ang idea actually here, yung mga drugs natin na susceptible to degradation by the GI, pH, or enzymes, pwede sila i-formulate into a buccal na dosage form kasi in buccal dosage form, they are not exposed to such degradation factors. So, mauna siyang gina-point out sa atong third bullet. Then lastly, it can be done in patients with swallowing difficulties, nausea, or malabsorption syndrome, and even in unconscious patients. So, kaning buccal and sublingual na dosage forms, guys, or routes of administration, pero I think ang mas appropriate for this is dosage form. Dili ni sila gina-chew, ginabutang lang ni sila sa cheeks for buccal, then sublingual under the tongue, then hulaton lang ang mag-dissolve na sila. So there is no process of swallowing dinhi, which is useful for patients with difficulty in swallowing. Then, disadvantage of buccal and sublingual routes of administration: due to the small size of the oral cavity, only very potent drugs can be effectively delivered. Another is there is difficulty in keeping the drug in the site. Another is there is a need for the patient to refrain from swallowing, talking, or drinking during administration so as not to affect the residence time in which the medication is in direct contact with the mucous membrane. And lastly, this is not applicable to bitter or bad tasting drugs. Then, in terms of plasma concentration curve, kamo na magbasa din ni ang slide kaysa. Pero main idea, for buccal, yung plasma concentration curve niya, there is a moderately fast rise sa concentration ng ating drug. Then, there's a higher bioavailability than the oral na administration. Meanwhile, yung sublingual naman, there is a quick rise as well sa plasma concentration. Then, almost as fast as IV for certain drugs for our sublingual. Now is our rectal na route of administration. This is a route of administration where the drug is administered via the rectum. And ang advantage nito, this is useful when oral route is not possible. So, for example, yung paracetamol natin, if yung baby natin or yung children natin hindi marunong mag-swallow ng tablet and let's say walang available na other dosage form na oral, pwede tayo magbigay ng suppository na paracetamol. Then another is the partial avoidance of first pass metabolism. Then for disadvantage naman, absorption can be inconsistent and there can be patient discomfort when administering drug rectally. Then ito na yung list of characteristics of our rectal na route of administration or our rectal drugs. Then please read through this na lang sa ating reading material. Then in terms of the plasma concentration curve, guys, variable basta rectal, then they are typically slower than oral but faster than topical. Now let's see if nag-match lang. Yeah, ayun. General idea, again, variable ang plasma concentration curve ng rectal and they are typically slower than oral but faster than topical in terms of achieving the minimum effective concentration and or as well as the maximum na or the Cmax natin. Then our next route of administration is the subcutaneous, and this is a hypodermic administration. In basic terms, this is the injection into the tissue beneath the skin, and this is usually performed on the external side of the arm or thigh or on the anterior face of the abdomen, and generally it admits smaller injection volumes than the IM route. Then kamo na pud basa ani guys sa reading material, pero take note lang of the advantage of our subcutaneous na route of administration. This is suitable for self-administration when talking about parenteral na route of administration. If i-compare natin siya sa intravenous, yung subcutaneous natin, mas okay siya. So, mas okay siya for self-administration. So, for example, yung insulin natin, di ba, ang mga diabetic patient na to usually, sila raman po ang nag-administer sa insulin nila. Then, another is, in subcutaneous na route of administration, yung release of drug natin is slower and sustained. Another is, or ang disadvantage naman, limited lang ang volume basta subcutaneous. Then, there is a slower onset than IM or IV. Then, in terms of the plasma concentration curve, there is a gradual na increase sa subcutaneous natin, then longer ang duration niya. longer ang duration niya. Then, itong sa intramuscular naman, guys, take note lang na basta intramuscular, guys, this is an injection into a muscle. Then, ang advantage niya, it is fast, or it has a faster onset than subcutaneous. Then, it also has a larger volume than subcutaneous. Pero, disadvantage natin dito, it can be painful and there is a risk of nerve damage or bleeding. Then, in terms of plasma concentration curve, there is a moderate fast rise sa kanyang concentration and there is a prolonged action. Then next, for our pulmonary, this is related to the drug administration to the respiratory tract and pathologies like chronic obstructive pulmonary disease or COPD, asthma, cystic fibrosis, etc. So basically, yung pulmonary na route of administration natin, it involves drugs or inhaling drugs into the lungs. Then, ang advantage nito is the rapid absorption due to the large surface area sa lungs natin. Another is it bypasses first pass metabolism. Then, ang disadvantage nito is technique dependent siya and there is a limited lang yung drugs na suitable for this route of administration. Then in terms of plasma concentration curve, there is also a fast rise and the concentration for this route of administration. Then similar to IV din siya in some cases. Then lastly, we have the nasal route of administration. In here, the drug is sprayed into the nasal cavity. Then, there is an absorption of drugs across the nasal mucosa. Advantage nito is rapid onset. Then, another is, it is invasive rather, and it bypasses first pass metabolism. Disadvantage niya is the limited dose and nasal irritation. Then, in terms of plasma concentration curve naman, there is a quick absorption. Then, the peak is reached rapidly but not as high as the intravenous na route of administration. So, that is a summary of our nasal na guys, na route of administration. And, ayun, please read through this na lang. And, again, to learn more about our routes of administration, especially their plasma concentration curve or their pharmacokinetic na implications, read the reading material nga naa sa atong drive and appeal to siya sa coverage nato. So again, take note ha with regards to this discussion, then submit ninyo siya sa folder nga naa sa drive link na isend nako. Then ang folder name ato kay assignment. So, dito ninyo i-upload ang inyong notes in PDF form. Sige. And again, guys, ang reading material nyo or reading assignment nyo, naara po dito sa folder. So, that's it, guys. Thank you for listening.